the question around accountability institutions for health, I want us to start from a simple question. What is our approach to health as a country? Is healthcare a commodity? Is healthcare a commodity like beer that we can flip-flop around with? So how do we approach healthcare, first of all? Or healthcare is a fundamental right for every person. Therefore, it is an obligation of government to provide quality healthcare to all citizens. The approach that we give health would then determine how we engage, including with the question of health financing. Because if we approach it as an entitlement to all of us, irrespective of your means, irrespective of your extraction, it means that even the approaches of financing will factor that in. And we will then eliminate what we call discrimination or exclusion in healthcare. And all the conversations we are having, the challenges they raise is that we have Kenyans who cannot access the healthcare they deserve. If you get the experience of Grace, Grace knew where to go. How many millions of Kenyans do not know even where the SHA offices are, where MOH is? And yet they still deserve healthcare. And then we also need to ask ourselves, where have we been investing in health? And where are we investing in health? Because if we don't ask ourselves these fundamental questions, we then tend to treat health as a commodity, not an entitlement of everyone. Having committed under the SDGs to universal health coverage, if it is universal coverage and reducing the financial burden out of pocket payment that ends up denying people access to healthcare, we then must approach it differently. Enable everyone to access quality healthcare that they need at the closest level possible. And so I get back to the accountability institutions, or the questions that you've asked me. As a lawyer, I am more familiar with legal accountability. All these institutions we have mentioned are creatures of law, and they have legal frameworks that they work under. We want to ask ourselves, it is accountability for who? If that accountability is not going to facilitate access to healthcare for all Kenyans, then that accountability measure is not effective. If we are talking about parliamentary departments, the development of law, Parliament is a critical organ in engaging with all proposed laws. But how come then we ended up with a new legal framework that does not meet the needs of the population? Did our representatives in Parliament, both the Senate and the National Assembly, represent the interest of the citizens? Because this SHA is established by an act of Parliament. And let us not forget that we also still have the Ministry of Health with sizable annual budget for implementation of health programs. And then let us move to, I would not want to speak about the audit institutions because those come after the fact. I want to ask to then look at what have our courts done on the question of access to health for the citizens. When the other systems have failed, with the protection of the right to health under Article 43 of our Constitution and the right to emergency health care, then citizens are left with options including going to court to seek to enforce that obligation of government, so that in whatever engagement, in whichever framework the government is rolling out healthcare services, it should then protect the right to health. Professor Mutakangu has already mentioned what the courts have said about the new health system. But we also know that when this was all stopped, at one point the courts again allowed it to continue. Are we seeing a politicization of the judicial decisions when it comes to access to healthcare, especially because money is involved? Are the decisions in the best interest of access to health, or it is a clamor for collected resources and the question of access to pooled funds in this country? Remember, I asked that what is our approach to health? Who is benefiting from the resources we collect in the name of healthcare service delivery? Are we investing in public health facilities? Where is this money going? Who are the largest beneficiaries of the funds we collect in the name of health financing? And if we do not critically look at this, we are beginning to create two classes of citizens. Those who can access healthcare that is funded by the public, and the public that contribute to the financing of health but cannot access quality healthcare. Why? Because the facilities they access are not adequately resourced. And it goes back to what Professor was saying, that what is the ideal model of financing healthcare in the country? What is workable? What is sustainable? If we are collecting to pay largely private institutions because they have invested in health, and not with the same measure investing in public health institutions, what are we doing? We are making those public health institutions unattractive, inaccessible. Nobody wants to go to them. Why? Because they have no personnel, they have no equipment, they have no supplies. And then we promote private enterprise. The reason why you invest in the private enterprise is for profit. So when we are promoting private enterprise only, we are saying health is a commodity. It is not a fundamental right. I can't claim to be an expert in health financing, but I dare say any model that does not ground the public health sector as the primary quality healthcare delivery mechanism in this country, and that private health sector is complementing public health sector, that model will not succeed, and it is a foundation of discrimination of citizens, creating the haves and the have-nots, that the haves will get better healthcare funded by the have-nots will not get any healthcare service. And it is a conversation we must have. So when we are talking about accountability, citizens' accountability must be the first place. We, the citizens, must ask ourselves, where is our money going? When you are taxed and government is allocating resources for health. Where are those resources going? And citizens organized variously, civil society, pressure groups, and media. And I want to close by giving you a very good example. I have litigated several cases in court, in particular around access to quality maternal health care, addressing the issue of detention, neglect, and abuse in healthcare facilities. And one way that detention happens in healthcare facilities is payment. And this is how payment happens. You are covered under NHIF or SHA. You have sought treatment. The doctor has certified that they are done treating you clinically. You should go home. There is no approval. You are detained in a health facility. You seek health care on the promise that the following services are covered. When you go to hospital, upon treatment, you are now told some services are not covered. For example, critical care that you needed, you are told is excluded. For those in the service healthcare delivery system currently, I know that even what we are calling the benefits package under social health insurance or authority excludes the basic healthcare services that Kenyans need, including women and girls. So who is it serving when you are excluding basic needs that the majority of the population require, or you give them the least allocation that will not meet the requirement or the charges that the hospital will demand? It means when these Kenyans seek care, they are going to be jailed without being tried in those health facilities, detained until when they raise additional funds. My experience with Pumwani Maternity Hospital and Bungoma County Hospital in two separate cases where we challenged the detention of women post-delivery for inability to pay medical fee, the High Court was very progressive. In one, condemning detention for inability to pay fee as being unlawful and constitutional and a violation of the rights of the patient. And this detention extends to detention of bodies of patients who have passed on. It is a fundamental conclusion of law that the body of a deceased person is not property. You cannot detain it for purposes of seeking payment. But this continues to happen. And so in closing, as Dr. Mutakangu said, the devil lies in the details. Even what Kenyans are promised as a working system, if you ask yourself, what is the benefit for the citizen? It is very narrow. And so we must go back as citizens to hold our government accountable. And let us not wait only to go to court, because we therefore see that the political pressure on the courts to let the system continue, irrespective of its weaknesses, is so immense. Let us start addressing the problem from its roots. Let us hold our leaders accountable. Let us highlight the gaps and the challenges. Grace is just an example of the things we can do. If it is not working, let us call it out as not working, because health is not a favor from government. Health is a fundamental right of all citizens. And there is no excuse, no argument should be said that there is less money allocated to the Social Health Authority. No, we pay taxes. If government cannot offer health care, it has no business being in government. It should go home. Thank you.